Welcome to the Cricket and Oz Vitality Dispatch Electrotherapy video. Here at Benicera Chiropractic, we have a couple different electrotherapy devices utilizing electrical currents to have a physiologic therapeutic effect on our cells. The general premise behind the specific effects on the tissues with electrotherapies is that there is a difference in electrical charge inside of the cell versus outside of the cell. There's also a difference in concentration of ions or nutrients inside of the cell versus outside of the cell. With this electrochemical gradient, the different substances that need to go in or out of the cells can be transported directly through transport portals within the cell membrane. And also some of these ions and nutrients can flow through the cell membrane themselves without being transported. The electrotherapies have an effect on this electrochemical gradient. So as we pass these electrical currents through the tissues and thus through the cells, we have an effect on this electrochemical gradient. Different frequencies, different intensities, different waveforms of the electrotherapies can have differing effects on different tissues depending upon what the condition is that we're working with or what the therapeutic benefit that we're looking to get. The first therapy is frequency-specific microcurrent. There are a number of different frequency-specific microcurrent units. Currently, we're using this smaller home unit, which has specific frequencies programmed into the unit, and we can use the different protocols to have different therapeutic benefits. The frequency-specific microcurrent is in the realm of microamperage. Microamperage is the smallest amount of current that we use with the electrical therapies. It is the most comfortable by far, where most of the time patients do not feel the current or they might feel only a slight tingling. So we have leads that come from the unit. Two leads will be put on one part of the body. The other leads will be put on another part. We can run the therapies from the neck all the way down to the feet, running these currents through the whole body. The device can also be utilized where we have the leads on one part of the body and then out towards the other end, working on an arm or a leg. The other electrotherapy unit we have here is a combination therapy unit. And this has a combination of interferential current, premodulated current, Russian stimulation, and also microcurrent and high volt galvanic current. Mostly we use the interferential current, and with the interferential current we are using two channels with positive and negative. We use these self-adhesive electrode pads to conduct the current through the skin into the tissues. With the interferential current, we are utilizing a current that flows between these two pads and a current that flows between these two pads. As the current is flowing between the pads, they are creating an intersection in the center. As the currents interfere with each other, they drive the current deep into the tissues, thus interferential, having an interference in the current, and we're able to have a therapeutic effect on the deeper structures within the tissues that we're wanting to work on. The premodulated current is for working on the extremities, where we'll have one pad out towards the end of the extremity. The other pad will be closer, utilizing that same electrical stimulation in areas where we're not able to effectively use four pads and use the interferential current. The Russian stimulation therapy utilizes a different waveform of current, and the Russian stimulation is utilized for contracting muscles and helping to improve the strength of muscles. As we apply the Russian stimulation, We can have the patient just at rest and contracting the muscle, stimulating the nerve communication to the muscle and stimulating the muscle to contract itself. We can also have the current flowing and have the patient go through ranges of motion and actually activating the muscles in order to improve the strength of a weakened muscle. So if there's an imbalance in muscle strength from one side of the body to the other, or from the muscle that is contracting the agonist muscle or the muscle that opposes the contraction of that muscle being called the antagonist muscle, we can strengthen one that has gotten imbalanced in response to the action of the other muscle. The other currents that we have is the high volt galvanic. High volt galvanic, again, has different waveforms, a little different electrical current, and the high volt galvanic does create muscle stimulation in a similar but different way as compared to the Russian stimulation. Thank you so much for watching the electrotherapy video.